Hi, I'm Barb Angelo. Happy Friday and welcome to Open Mind, a show about all kinds of good stuff for the mind, body, and soul. You know, every week I like to talk to people who are doing things a little differently. They're helping people mentally, emotionally, physically, or spiritually. And today my guest is doing just that with his practice. Welcome to the show, Dr. Stephen Horvitz.
Thanks for having me, Barb.
Well, you know, thanks for taking time out of your busy day to come here as a guest. I know your practice is a little bit close to the studio, which is convenient, so I'm glad you were able to make it on a Friday.
Thank you. It took me about a minute and a half to get here, so it was perfect.
And then a half-hour wait, right,
Yes.
while we were in the green room, talking and discussing things. And on that note, I asked you, I said, if you could describe your practice in one sentence about what you do and why you're a little bit different, what would it be? And you told me.
Okay. My practice is a pretty much family practice, a combination of traditional with a lot of holistic prevention and wellness involved in that, as well as we're a direct primary care practice where we get to spend a lot more time with patients to figure out what's going on.
And this is what we're going to be talking about a lot because I love this. I love this because personally I think pretty much anybody and everybody that goes to a doctor on a semi-regular basis is a little frustrated. At least I know I am. My doctor's frustrated. And what you're doing, let me ask you a question. We didn't talk about this beforehand, but is this the same thing as concierge? It's called like a concierge doctor? Is that the same thing that you're doing?
It's a similar concept, but it's a little bit different.
Okay.
I love concierge medicine, and the docs who are doing it provide wonderful care. Concierge care can be a little more expensive care than what I'm doing. So we say we do concierge level care, 90-95% of the care for half to 1/3 of the costs. And that's where our niche comes in. So what we do is direct primary care, where it's a monthly or yearly fee, and it's usually about what a cell phone monthly fee will cost you. It's not that expensive.
Wow.
And people get terrific access and terrific care.
So let's talk a little bit more about that then. So you don't take insurance, correct?
Correct.
And you spend more time with your patients. So is it the kind of thing where then, say you're not sick for a year or 6 months, do your patients still kind of come in just to do like maybe preventative care and things like that? Because you're holistic, and we were talking about a mixture of traditional and holistic.
Correct. Yeah, initially when people come in, we're trying to move away from doctor visits being thought of as just for sick care. We're trying to move towards well care and preventative care. So I know in our office when we have a new patient come in, we usually spend an hour with them the first visit, getting to know them, getting their full medical history, physical exam, set up for some testing. That takes about an hour.
Right.
A couple weeks later, we bring them back for a second visit, usually another hour, where we review all of their testing and how it pertains to them, not how it pertains to everybody else who's ever had the testing, but how it goes with their medical history and what they're trying to work towards, what they're trying to prevent.
Okay.
If their whole family has had diabetes and they don't want it, we're going to look at these tests and say, well, you're on the verge. Here's what to do to not let that happen. So even if people aren't sick, they almost always come in for their wellness visits, which gives them enough information and advice to stay healthy where they're going to stay with our practice.
Right, to let them know they're on the right track. They're
Absolutely.
keeping that good health track. So when you talked about testing, is it the same test that when everybody comes in you do? Is it blood tests or what kind of test, or does
Blood
it depend
test.
on what the person's
Yeah,
issues are?
we have a general panel that we start with, but we can zig and zag depending on what we find out about the patient and their medical history. So we won't do any testing until that initial visit where we know who they are, what their issues are, what they're trying to work on. And then we will put some extra in, take some out, that whatever is pertinent for the patient.
So I think what you do is so interesting, again, because healthcare is such a big issue. Insurance is a big issue, doctor visits, and I know from my experience, and I was telling you, my family doctor, who I've known since pretty much he got out of medical school, and the practice has grown so large and it was taken over by a bigger practice. So he was voicing his frustration to me and saying, I like spending time with my patients. I like asking them questions, personal things. And that's how you get more information too about what their health is like, just in having a conversation. But he said, now I have so many minutes that I can spend. And you were telling me, how many minutes does a typical doctor usually spend, or has enough time limited to
For
spend?
primary care, what we hear now is 6 to 10 minutes average per patient in the traditional healthcare system. It's because they're seeing 30 to 40 or more patients a day, and there's only so much time in the day. And I left that type of system because by the time I said, hi, how are you, what's going on, bad joke that I would say.
And that could take a few minutes, just
Exactly.
to joke alone.
But that time it's, okay, now what are you here for? Okay, and we didn't have time to get into it. Here's a script, go get this done,
Right.
or get this, medicine. Well, that doesn't work because we're not really getting at what's wrong with the patient.
Mm-hmm.
Now, if we have 20 minutes to an hour per patient, depending on what they're coming in for, we have time to learn why they're here, what's going on, to have that conversation, to figure out what's really happening, as well as to hear all the bad jokes. So it works out really well for both of us. I can do a better job because I have time. We get to know each other better. We build up trust. It's just a much better system for primary care.
Right. How did have you always done this, number one? So I'm not gonna ask you your age, that's a personal question, but how long have you been a doctor?
Okay, I've been out of practice for 25 years.
25 years
I'm
in
only
practice.
29 years old.
Okay. Well, that's amazing. You started at 4 years old, so you must have been really top of your class to even get to medical school and finish it.
They called me Doogie when I was younger. I've been doing this for 25 years. I worked with a doc for 4 years, was a very good guy, but I always wanted to go out on my own. So I left and started my own practice in 1998. Traditional practice, I was still a little more holistic, a little more prevention, but taking insurance, I didn't have the ability to spend as much time as I wanted. And as we got busier, it made it even more difficult. So about 10 years ago, I just switched all in one day. January 1st, no insurance. We're doing it the direct
Started
care
a whole
way.
new thing.
Yes.
Our time's already going by so quickly, but I can't wait to talk to you some more, so we're gonna take a quick break, and we'll be back in a few. Join us then, thanks. Hi, we're back. Thanks for joining us. I'm Barb Angelo, and you're watching Open Mind, a show about all kinds of good stuff for the mind, body, and soul. My guest today is Dr. Stephen Horvitz, and we've been talking about what he does, which is a little different, but what I think, and you probably will agree, I guess, that I don't want to say it's the wave of the future, but a lot of doctors are maybe going this way, which is what you're doing. And first of all, you blend traditional and holistic.
Correct.
Traditional medicine and holistic medicine. And we were just talking about how you do things a little bit differently. You're not taking insurance. You're seeing people for an hour for a visit or
Correct.
half an hour. You're spending a lot more time with people. They're paying out of pocket, but you're keeping it very reasonable for your patients.
Correct. In the system we use, people pay a monthly or a yearly fee, but then they have no co-pays when they come in. Their monthly or yearly fee is exactly the same whether they're in my office for 2 visits a year or 25 visits a year. It doesn't matter. We're pretty much, you could say, on retainer for them. So all of our incentives are aligned. I don't earn more of an income if I see them 25 times than if I see them twice. So our job is just to do the best job we can for the patient, keep them well and healthy. If we keep them well and healthy, they won't need to see us 25 times because they won't need me as much. They can be healthy and doing what they want to do with their life each day. And then they will stick with me at my practice because we're doing our job. So it helps when our incentives are aligned. The traditional healthcare system, while I think it's still the best in the world, on a fee-for-service basis, the incentives, at least income-wise, aren't the same, where each time you go to see somebody, you're getting paid again and again and again. And sometimes, some people can find that a little, unnerving, even if it's necessary. It's usually necessary, but it can still be a little unnerving. So by having it this way, where it's the same fee, monthly fee regardless,
Right.
patients don't worry about it. They know, oh, he's there if I need him.
So let me ask you a question. Is it just you, number one, in your practice? Or are there other doctors? You were mentioning one of your associates who does some other things. I'm just curious as far as time, because do you need to be available for a lot of time for people that, if they're paying you a monthly fee, do they kind of feel like you're on call all the time?
That's a good question. No, I'm the only doc in the practice, okay? But we limit our practice to 1,000 patients or less. A normal traditional family practice would be 2,500 patients. So we have 40% of the patients. So right there, that gives us 2.5 times more time available to see them and to spend with them. Second, when we spend so much time with them initially, that hour first visit, that hour second visit, to get to know them and work on their wellness plan, they do well. They know that we're available. By that time, they understand the concept. They know I'm there. And sometimes I have to yell at patients when they're really sick. Oh, I don't want to bother you.
I can't picture you yelling at your patients.
Well, it's usually yelling in a sarcastic, funny way, but yes, it's like, look, if you have a runny nose at 2 a.m, yeah, don't call me.
Right.
If you have 102 fever and you can barely breathe,
Right.
call me.
Maybe you should call me.
Don't say I didn't want to bother you. Call me. That's my job. But again, if we do a good enough job on wellness and prevention, we're hoping that your sick visits are less and less, because that should be the goal of primary care. Primary care should be keep people well, not just treat them when they're sick.
Exactly. Because I found personally too that I don't see the doctor that much, but when I'm sick, if I have, more than a runny nose, sometimes it takes 2 or 3 days to even see them. And I think, well, by then, really? And you don't, now urgent cares are everywhere. And I think that urgent care is probably making a lot of money because the same thing, you can't see your doctor, or there's some people that don't even have a family doctor anymore.
I think urgent care sprang up because the traditional healthcare system, where you can't get into your doctor, they're filling a need. So I'm glad they're here.
Right.
What we're doing with direct care or direct primary care is with less of a patient panel. 98 to 99% of the time, we will get people in same day or next day. I tell all my patients when we first see them, if you're sick, you call us at 9 a.m. on the day we're open, and we will do our best to get you in that day or the next, or at least talk you through what we got to do until we can see you. Because we schedule our patients where there's always some time open in the morning and afternoon on days we're there for same day call-ins, for urgent calls, for people who need to be seen. So again, when you don't have a 2,500 patient panel, when you have a manageable panel, you can do this, and you can give people the care that they need, and really the care they deserve.
And it sounds like, from what you're telling me, it's not just wealthy people who can afford to have this, because it sounds like a luxury almost as you're describing this, that the average person can afford it and the average person can benefit from it.
Correct. We have people from all income classes. We have people who, they're working minimum wage who come to see me. We have people who are making a lot more than minimum wage who come to see me. There really hasn't been a cutoff.
Right.
Everybody comes. The cutoff is really the patient's decision. Do they value their physician? Do they value their relationship with their physician? So if they're used to seeing a doctor in the traditional system for $5, they've in essence valued their doctor visit at $5.
Right.
Whereas when they see me and they're paying a monthly or yearly visit fee, the value they see in my services are different. And that helps with our relationship, because now we value each other. I value them because they're paying me more than they would to go to a doctor in their insurance, so I have to value strongly that relationship. But I know they value the relationship with me as well, because they're going to get the care that they need and deserve, and I'll be available to them.
Wonderful. So we're going to take one more commercial break and we'll be back. Hi, we're back. I'm Barb Angelo and you're watching Open Mind, and today my guest is Dr. Stephen Horvitz, and we've been having a great conversation about traditional healthcare versus what he is doing with his practice, which is a little outside the box, and it sounds wonderful. We've been talking about your blend of traditional and holistic care, and how you're not a concierge doctor, but you're doing things a little differently, where people aren't going through their insurance. They're paying out of pocket, but it's reasonable. They're paying a monthly fee or a yearly fee, and they get to see you as much as they want.
Correct.
Do people ever take advantage of that?
Rarely.
Okay. I was
Rarely.
gonna say, because really, if you don't have time to do other things and you wanna
Yeah.
spend it with your doctor, but you do tell really good jokes, so I can see how they'd wanna have your company.
I try to talk to some of my colleagues about this, this is a great way of practice, you will love it, patients will love it. And they're going, but patients will call you all the time, they'll
Right.
bug you because, you know, it doesn't
You're always
cost them
available
anything
to
extra.
them, right?
And they don't. Because once patients get to know you and get comfortable in the system, which is usually after the first visit or two, they realize this is something different. This is a doc who takes his time, this is a doc who's really trying hard to get to know me. And once they realize that trust is there, they don't want to break it. So they're not going to call you with every little thing where they don't need to. You almost have to yell at them to call you when something really is going on. So no, they don't take advantage. I think in the 10 years I've done this, maybe one patient did, and he self-selected himself out of the practice because he said, I find myself coming in here just to get my money's worth.
Oh, wow.
I'm like,
wow.
well, if we helped you to become that healthy and you don't need us,
Mhm. We've done our job.
we've done our job.
Exactly.
And when you need us again, come back.
Right. Well, I imagine there's a real sense of, as you're talking, I'm feeling a sense of comfort and security knowing that you're there. So like you said, you don't have to take advantage of it, but just knowing, well, if anything does come up, I don't have to think, oh no, I need to get there 8 o'clock before all the phone calls come in. You have to play that phone game of getting through the doctor before everybody else does to get an appointment. That it must feel very comforting to know that you're there and that they're being taken care of even when they're not seeing you. They feel like they're being taken care
Yeah,
of.
well, when you have a smaller patient panel, you get to know people. So once we've seen you once or twice, we'll see you walk in the door. We pretty much know who you are. At least we do our best to.
Right.
And there's a comfort in that too. We try to get people in when they need to get in, so there's a comfort. So once, if you're new to this system as a patient, once you are in it for a few visits, you get it. It's very understandable. Comfort is great, value is great. Some people who we've had in the practice for 10 years doing the system, and they always get like a sinus infection every September. You know, we've treated them 5 times already with it. Now they call me or text me and say, I got it again. Do I need to come in?
Mm-hmm.
Here, let me call this in. If you don't get better, you get into the office. So it saves them time too. In the traditional system where you're being paid each time a visit happens, doctors won't really want to do that because if you do it over the phone, they're not getting paid for it.
Exactly.
So even though it really would be simpler and easier to do it the way I did it,
Because you know, like you said, it's a recurring
Correct.
thing that
They
you're
can't.
familiar with.
Correct.
Right.
So the system, like I said, aligns incentives between patient and doctor. It also aligns the incentives with the whole system in general with healthcare and insurance, in that if we do a better job in primary care and keep people well, they're going to need less of the expensive care, which then really brings the cost of the system down. And who knows, maybe eventually healthcare will be less expensive all around for everybody.
Right, wouldn't that be nice? What is your typical patient? Do you have a typical patient?
I see kids starting at 6 and above.
Mm-hmm.
You know, and then go through until elderly. The most common patient I have are people 35 to 60. These are the people who have kids, or their kids are a little bit older and are just starting to realize, I gotta get healthy. These are like my real years to really figure out and stay well, so I don't have all these chronic conditions
Right.
my family had when they got to this age. So they're coming into me to say, what can I do to get well or stay well? What can I do to not have diabetes at 60 like my mom and dad did?
Okay.
So these are the type of patients that I have a lot of now. I'm getting a lot of new patients in who are looking for diabetes management with less medication, more with diet and lifestyle adjustments.
Right.
Same thing with high blood pressure, people who are overweight, and lately a few people for autoimmune disease, because we're looking for lifestyle adjustments for that instead of just the meds. We don't say stop the meds if they're with other doctors, but we try to get them where they're doing better. So maybe the other doctor can say, hey, you're doing well, maybe you need less of those medications.
We have a little bit of time left, and I want you wanted to talk about Our Health, something that you and I were talking about. What is Our Health? And then we want to tell people how they can find you, how they can contact you.
Well, you can find me at www.drhorvitz.com. That's drhorvitz.com. DRHORVITZ.
Horvitz,
dot com.
Horvitz, right.
Our Health is a direct primary care company that is helping to change healthcare in New Jersey. We're opening up similar offices to mine in direct care throughout Jersey. We have 4 or 5 now in South Jersey. We'll have 8 throughout Jersey by the end of the year. We'll be expanding from there, and it'll be the traditional. Some doctors will be a little bit holistic as well, but that same patient panel of 1,000 or less, get to know your patients, get the trust. What we're trying to do is make healthcare better, bring that doctor-patient relationship back to the forefront where you like your doctor, you like going, you don't like
mind
going
going
to
to
the office,
the
but you
doctor.
don't mind, you know that you're being
Exactly.
cared for, they know you, they're trying to do their best for you, and that's what we're trying to bring out.
You've been a wonderful guest, I have to say. Thank you again for taking the time out to come and see me and to talk to the audience and share some wonderful information. And again, have a great Friday, great weekend. I'm Barb Angelo. You've been watching Open Mind, and you can reach me at barbangelo.com. Thanks for being with us.